So welcome to everybody. Today we have the pleasure to have with us Sir John Armstrong Muir Gray, who is a British physician who has several senior positions in screening, public health, information management and value in healthcare, such as Chief Knowledge Officer in the National Health Service UK. Welcome, Professor Muir Gray.
Thank you.
So, Professor Muir Gray, you had a very strong experience as a public health expert, and we see that the pandemic situation affect all the Western countries in a tough way. In your opinion, how this healthcare system react to the pandemic situation?
Well, I don't think we have a system. We have a set of structures. Every organization consists of a structure, systems, and a culture. And in the health service, we always look at structures, not systems. Now, one of the good things about COVID is that it has made us develop a system. A system is a set of activities with a common set of objectives. So it's brought everybody together. And that's why crises are good, that we can use them to look at how we should run things. And what I see happening in future is that we need now to change healthcare so it no longer consists of just lots of structures, health centers and hospitals and drug companies. It needs to become a system. For example, a system for people with rheumatoid arthritis, a system for people in the last year of life. So COVID has taught us a lesson, and the specialists in communicable disease say you've got to look at the population, not just the cases, but the population.
And Professor Gray, considering the consequence of the pandemic situation, how do you think those public health systems should evolve?
Well, they have to recognize what is happening in the world out there. And it's very clear we're in the third healthcare revolution. Rivoluzione, risorgimento, rinascimento, call it what you want. The first revolution was the public health revolution, mostly concerned with governments controlling communicable disease. And of course, this is still a public health task, controlling COVID. The second revolution of the last 50 years, my time in medicine, has been astonishing. It's been the high-tech revolution. Chemotherapy, transplantation, hip replacement, amazing what's happened. But at the end of the third revolution, we have a number of problems. And this was evident before COVID. There's need and demand is increasing faster than resources. There's inequity. Poor people get less good health care than wealthy people, even in countries committed to universal health care. So we need now to be the third healthcare revolution driven by three forces: citizens, knowledge, and the internet. So that will be the basis of how we bring about the changes that are required after COVID.
And thanks. And in this revolution, in those last months, we noticed a very strong growth of the telemedicine. And this is even a digital revolution for the medicine. How do you think clinicians and health professionals will have to change their skills in the coming years?
Well, the internet has blown away the locked doors of libraries like dynamite. So it's diminished the authority the doctor had because of knowledge. And as I say, knowledge is one of the driving forces. Actually, I think it's a major challenge for clinicians, and they're always slower to react than members of the public. So this is something in which we need to address the question asked by Bill Gates. He said, in every organization, the key question is to ask, what is the function of the human being in this organization? So we've had the doctor as the person with knowledge, and the person called the patient comes in to see them and doesn't remember a great deal of what's said to them, partly because communication skills are very poor. But that has to change dramatically. And that has changed because of COVID and the need for distancing. So I see a dramatic change in the role of the person called the patient and the person called the doctor.
Thanks. And one last question, because in the past year, you teach to us, especially in UK, but even in Italy, was published one of your bestseller, SOD 70. In Italy, the name was Adesso, 70 Adesso. Even SOD 60 in Italy, 60 Adesso, which is going to be published in the upcoming months. You teach to us the role of the empowerment of the citizen. How is going to change this role, considering the perspective change of every one of us about health during the last year, and the need for the sustainability of the national healthcare system in the next years?
Good. Well, we now know from science that aging is not a cause of major problems until the late 90s. The problems are due to loss of fitness, due to disease complicated by accelerated loss of fitness. And the third factor is negative thinking, ageism, the belief that if you've got a health problem, you should do less. The fact of life is that the longer you live, the more active you need to become. The more conditions you've got, the more active you need to become. And I'm not talking only about physical activity, but also cognitive and emotional activity. We can reduce the risk of dementia by about a third, and that requires individuals to take action. That's another risorgimento.
Thank you very much, Professor Muir Gray. It was really a pleasure and an honor to discuss with you about our future and our health.
Thank you very much.